A heart attack is a very serious condition where the blood supply gets cut off to part of the heart muscle, and that's usually caused by a blood clot and cholesterol buildup, and that stops the blood flow, oxygen, and nutrients to the heart, starts causing a lot of pain, and eventually damage and death to that section of the heart muscle. The warning signs of a heart attack are usually pain, located in the center of the chest. A lot of our patients will say it feels like there's a fist right there, or a weight or heaviness on the chest. And that is because of the lack of blood supply causing the nerves to be damaged. It also can be associated with shortness of breath, sweaty, clammy sensation, particularly the forehead. The discomfort can go into your back, frequently up into your neck or down your arm. I've even had people tell me their teeth hurt, and those are all signs of a heart attack. You can also be lightheaded, a little dizzy, and nausea comes along with it frequently. The best way to prevent a heart attack is to try and live a good, healthy lifestyle, meaning if you're diabetic, find out, be treated. If you have high blood pressure, find out and be treated. If you're a smoker, you got to quit that. That's out of 10 things to do, that's the top 7. Exercise, get your weight under control, and check your cholesterol with your family doctor and see what other risk factors you might want to modify to try and avoid developing a heart attack. People tend to delay seeking care because they don't want to admit they may be having a problem. There's a lot of denial. They think that it might be indigestion and it will go away if they just wait it out a little bit. They also sometimes don't want to embarrass themselves by showing up in a hospital and not having a heart problem, and they feel like they've wasted people's time and money. That's not the way to look at it. Hours can be lost at home, waiting to call the ambulance, and that's all very dangerous to the patient. So we are much more interested in getting faster times to the hospital, getting the patients to recognize they're having a heart attack, and then get things moving. The heart attack is not an isolated incident. It's a chronic problem and needs to be treated aggressively for risk factors, and those people need to be followed over the course of time, because it's not like your appendix. If you take it out, you don't have appendicitis anymore. With a heart condition, it's chronic, and it can be recurrent, and we find it's very important to establish good rapport with their primary care physician and team with the cardiologist, and use that as a triangle to improve their health. I remember a cartoon once that the man came back from the doctor and said, "What did he tell you?" He said, "He told me to stop doing everything I like to do and start doing everything I don't like to do." It's key that the people get onto a better lifestyle, because most of them probably weren't doing it right before this. That's why they got into the problem with smoking and high blood pressure and ignoring those things. So we want them to be on the right track so we can keep future episodes to a minimum.